afternoon, everyone. I'll be presenting my paper titled Management of Retinoblastoma During COVID-19 Pandemic, Our Experience at Tertiary Care Center. I have no financial disclosures and there is no conflict of interest. COVID-19 and the imposed lockdown adversely affected the patient care services in all the departments of all the healthcare facilities worldwide. Children with retinoblastoma particularly need uninterrupted care due to few reasons, like they are systemically immunosuppressed and they have fairly high chances of disease relapse. This study evaluated impact on retinoblastoma services of a tertiary care center and reports strategies used to circumvent it. This was a mix of retrospective, cross-sectional and cohort study done at tertiary care center, and records of patients of retinoblastoma attending ophthalmic emergency from March 2020 to March 21 were reviewed. The cases were categorized based on their urgency and the management were as a modified treatment protocol. And the data were recorded related to demographics, clinical profile, and referral and management details of the patients. So this was the categorization used for urgency level during the COVID pandemic. Emergent cases were defined as extraocular cases of group E retinoblastoma with complications like neovascular glaucoma. Urgent cases refer to those which came for staging examination under anesthesia, or cases for enucleation like group E retinoblastoma and retinoblastoma on active treatment. Then there was a category of semi-urgent cases, which were the cases on active treatment but not falling in the urgent category, or regressive tumors requiring further focal therapy, screening of siblings of a case of bilateral RB with a family history positive detected germline mutation. And non-urgent cases were the regressed cases of retinoblastoma which were completed treatment for more than 6 months, and those who came for screening for the normal eye in a child with other eye already enucleated for retinoblastoma. This was the categorization given by American Association of Ophthalmic Oncologists and Pathologists during the COVID-19 times. So we utilized a modified treatment protocol where in operating room there were minimum personnel, less surgeons allowed in the OT, and there was use of protective equipment, protective personal equipment with face shields, and also the surgical team would exit the operating room during intubation and extubation by the anesthetists to reduce crowding and reduce exposure of the healthcare professionals to the aerosols. Also, during the enucleation technique, there was gentle manipulation of tissue to avoid any spillage of blood or body fluids. Even electrocautery and diathermy was minimally used during the muscle separation. And focal therapy was preferred over intra-arterial or intravenous chemotherapy, because for IAC or IVC, the child needs to be referred to different department. So there was an idea to reduce the number of visits of the patient during COVID-19 times. Counseling of parents was done regarding immunosuppression and a risk of contracting COVID-19 during the visits to the hospital. And the role of NGOs like Can Kids was a significant contribution, and it's worth mentioning. They helped in reduction of waiting time for COVID testing at the ICMR registered lab during the COVID pandemic time. They also helped perform coordination between the caregivers and the treating team. They would also help issuing of travel passes for parents to help cross interstate borders during the lockdown. The teleconsultations were promoted. The phone device was used for audio or video call with the patients and the caregivers of retinoblastoma patients. And there was scheduling of further EUAs was done over phone by a team of teleconsultation. Also, our Hospital Infection Control Committee initiated contact tracing and isolated the COVID-19 positive cases to a designated facility in the hospital. The high-risk definition was proximity of less than 1 meter from the confirmed case of COVID-19 for a duration of more than 15 minutes for non-aerosol generating procedures, or exposure in an aerosol generating procedure or contamination with respiratory secretion of a confirmed case without PPE. We saw 50 cases of retinoblastoma in the study. 62% were males, and there were COVID-19 testing in 47 cases. So this was the number of emergent case, urgent case, and semi-urgent case.
Dr. Yogita, you need to sum up.
Yes. So overall, there was reduction of attendance of patient of retinoblastoma by 78%. And we saw that in retinoblastoma, patients on chemotherapy, they have a risk for immunosuppression. So this triage on teleconsultation helped us to reduce the number of visits of the patients and to circumvent the problems faced by parents during the lockdown. Thank you.